Good afternoon, everybody. It's a coveted opportunity for me to speak against the navigation, second time in my career. 4 years back, I spoke against Rajshekharan in Madras against navigation, and that was exactly 1 week before I bought the navigation myself. And I used it for 5 years, then I draped it with nice green cloth, and I don't use it now. So Rajesh is a good friend of mine, so I hold some punches for him. And this Mahalakshmi Wala paper keeps on getting quoted again and again in the navigation and the outliers. Before I take any job, my job was easier in the morning by Steve McDonald's comment on one paper. The outliers do not matter much. So total condylar knee arthroplasty 16 to 21 year results by Gill and Joshi. Prosthesis survivorship at 20 years was 98.6% for patients. So if Rajesh proves me that it is more than that, for the next 20 years probably I'll take the navigation. Total knee replacement in young active patients, long-term follow-up by Insall Scott, 94% 18 years. So these are all excellent results without navigation. So one of the most common and successful orthopedic operation, surgical goals are accomplished using techniques that mechanically or visually reference anatomical landmarks to reconstruct the damaged joint. You don't need navigation for this. Visual reference is more than enough. Is navigation needed? Sorry about the grammatical mistake on the captain. We have been doing total knee since 50 years without navigation. Why navigation is needed now? Better result, or is it a publicity gimmick? Sorry, I'm not referring to anybody, referring to myself. Because after buying the navigation and making a big function in Hyderabad, my numbers jumped almost 4%. Can we replace human mind? We cannot replace the surgeon's mind. Bad for the business, bad for the technical reasons as well. The limitations, not for an occasional user, only people like Rajesh and Arun probably who will do thousands of joints. Steep learning curve, expensive. Value for money, that is the bottom line, especially in Indian context. I don't think it is value for money. Some problems like ligament balance still not addressed. Disadvantage, increased time, OT setup. Additional incisions required for attachment of the reference arrays, increase in hospital costs from the additional equipment, software and surgical time. And Rajesh showed a slide that the overall cost analysis will be better if you take the revision into consideration, which is a bit skewed up argument. Increased incidence of fractures or infections related to the pins and their incisions. It's a stress riser fracture here shown. Errors related to data registering, which you will all know that garbage in, garbage out. So whatever you register, it will be guiding you. I've seen people using the computer navigation and grossly malaligning the components, using it for 6 hours and all that stuff. So basically, it's the registration process, which are again dependent on the surgeon's factor. And bone cuts. And if Rajesh uses the navigation, but still end of the day, he has to cut it. On a particular day, if he's shivering and if his bone, if the saw is blunt, the cuts will be again go obscure. So unless you have a robot to cut according to the navigation, then otherwise the bone cuts will be absolutely out of the layers. So implanting again, there things can go wrong. 2 millimeters rotation that way, this way. Again, these are all mechanical, human-related factors. So if it goes wrong, if a trusted navigation system registers the anatomical mapping wrongly, the surgeon will perform the procedure in the wrong place. Literature search, positioning of the femoral and tibial components totally can introduce a considerable error in alignment regardless of how accurately the resection planes are made. Computer navigation versus conventional, no difference in functional results at 2 years. A navigated total knee replacement, meta-analysis, clinical benefits are unclear and remain to be defined on a larger scale. This is a meta-analysis as latest as 2007. CT analysis after navigated versus conventional, no difference between pre and post-operative data. Questions yet to be answered by Rajesh. Reliability of the CAS technique by less experienced or infrequent users. Impact on overall patient outcome, very important. Impact on prosthetic joint longevity and durability. And decreased frequency of revision surgeries. All these questions are yet to be answered. It relies on data input, as I said, garbage in, garbage out. And cannot define what we cannot agree upon. Example, ligament balance or rotation. Anytime when judgment is needed, you are the best judge, as it can, to tell you whether it is true or false. As at the end of the day, machine is always a machine, and I'm sure Rajesh I hope Rajesh will not end up like this. And can computer navigation make us better replacement surgeon? I don't know. The answer is the jury is still out. Thank you.